Welcome back to Conversations with the Co-op, the podcast where we explore pivotal topics in special education. I'm your host, Jeffrey Lee, K-12 Special Education Coordinator with the Paul Bunyan Education Cooperative. Today, we're diving into a topic that plays a vital role into helping students with disabilities thrive: physical therapy in school. Physical therapists do amazing work behind the scenes, helping students improve their mobility, physical function, and independence, all in a school setting. Joining me today is Tessa Capelle, one of our experienced physical therapists working in our member districts. Welcome to the show.
Thanks for having me.
Let's start with the basics. Can you tell me what physical therapy is in general and how physical therapy in the educational setting differs from that in what we might see a clinical setting?
Sure. Yeah, a physical therapist is a provider who helps a person improve how their body performs physical movements. Those physical movements can be in play, in school, at work, or with recreational or sports activities. It's generally a combination of exercises or movements that will help you increase your strength, your flexibility, and your mobility, and to help somebody move more safely and more confidently. So in a clinical setting, physical therapy may be prescribed by a doctor after an injury or a condition like joint pain, tendinitis, a ligamentous injury like a sprain, concussions, strokes, spinal cord injuries, traumatic brain injuries, etc. Or if there's a chronic condition like cerebral palsy, multiple sclerosis, Parkinson's disease, where a person's mobility and quality of life can be impacted without the interventions of a mobility specialist like a physical therapist. In the educational setting, this looks a little bit different. Physical therapists help develop therapeutic strategies and accommodations that are specific to a student's unique needs. Our goal is to maximize the student's optimal performance for learning, ability to perform self-cares, developing recreational and leisure skills, and promoting mobility in order to access their educational setting.
So my daughter had physical therapy a while back. The doctor prescribed it. Can I just bring that to school and say, hey, I need to have some physical therapy for my daughter. Here's what the doctor says?
Mm-hmm. That's a great question. Physical therapy in the school setting has to have an educational relevance. So it has to be related to a child's educational needs. So it generally isn't prescribed by a doctor. We look at it more at the child's ability to access their educational environment and participate at school. Oftentimes, we work with the outpatient therapists.
So their outcomes are a little bit different,
Outcomes
right?
are different. Sometimes a child needs more than just school-based physical therapy, I guess is what I'm trying to say, where they need that additional support from a clinical physical therapist.
So if a student had some needs, they could actually end their educational needs, but still need to go on for more of that clinical side of it because they're not at 100% or where they should be at with whatever that goal is. But it's enough for them to access their education.
Yeah, so if you think about a child with cerebral palsy, for example, or Down syndrome, or autism, they're going to have that condition for the rest of their lives.
Right.
But it doesn't mean that that is impeding their ability to access their education. So we have to look at that and help them, support them in that role.
That makes sense. So how does physical therapy support educational goals for students with disabilities? Like, what is the role of a physical therapist in helping students succeed, not just physically, but academically and socially?
Well, there's a lot of things that we can help support, and I think what I wanted to talk about today is some things that people don't really realize about what we do. In the school setting, we start with our earliest learners in birth to 3, and we're going into the homes, and we're working with kids and families and coaching families on how to best support their child's developmental needs so that when they come to school, they can have that framework and that structure of mobility and movement that they need to be better and do better in school. There's things that we can help with in a school setting, which would be optimizing posture, optimizing seating and positioning so that they're sitting upright or they're sitting in an optimal space so that they can see the board and pay attention to the teacher. Are there adaptive equipment that they need, like a walker or a wheelchair or a stander or a special seat to help them sit and maintain attention? We look at access and inclusivity, playgrounds, facility spaces, busing, recess, lunchrooms, toileting, all those things, all those routines throughout the day that a student needs to be successful at school.
I think those get really forgotten sometimes. That, I mean, you think of the bathrooms alone, it just becomes kind of that's just part of the facilities. But really, for a student to actually be able to get their education and participate with their peers, like that has to be a consideration too, that I think gets missed, right?
It does, and there's research that shows that independent toileting leads to better quality of life as a student ages and moves through the school process and then into, once they graduate, and into daily activities of living, whether it be through their employment or if they move into some sort of a supported living situation. The more they can help with that toileting routine, the better success and quality of life they're going to have. So we start at a young age working on independent toileting.
Yeah. Well, that's a great, I know I just had a conversation with Emily Musaeus about early intervention and stuff, and I know she spoke very highly of physical therapists and them getting in the homes and actually doing some of that stuff, so it's great to hear.
Yeah, some of the other things that we work on and assist staff with are evacuation planning, transferring, how to help move students that maybe have more of a physical impairment and how to move them safely, but also allowing the student to move themselves as much as possible in a safe manner. So we're assisting them, we're not doing it for them.
Right.
That's some of the things that we do. We also help with some of those tier 2 interventions in the classroom, whether it be a classroom setup, maybe some motor planning that the whole class can access, and then it's benefiting those students that need a little extra support as well. We've been working really hard on increasing motor experiences in our elementary schools and our early childhood settings, because kids are coming into school with more immature motor patterns just from lack of exposure. Yeah. Kids are playing outside less. They are on screens more. Yeah. There are, kids that are missing the stages of development, whether it be tummy time or crawling. And so we're wanting them to get that sensory motor experience at a young age, because that drives brain development.
I think I've talked with my wife, who's a music teacher, and she says, just having the kids sit on the risers, some of them are having a hard time. Well, more and more of them all the time are having a harder time sitting upright and being able to pay attention, because they just seem to be missing some of that core strength or whatever else. But I imagine when you start getting to the higher degrees of that it can really be difficult sitting in your chair or just even maneuvering and navigating the school.
There's actually the motor labs that we do is called Ready Body Learning Minds, is kind of based off of that principle and that training, and the person that developed that is a physical therapist, and her mantra is that a child that cannot move well cannot sit well. So if you can't sit well and pay attention because you can't move well, you're not going to be able to learn. And so a lot of the kids that are wiggling or they're moving or they can't sit still, they're getting kind of compartmentalized into categories or behaviors, and really they lack that ability to move well.
I think that's a really important point, especially if you've been a teacher for long enough. That fidgetiness, that moving around, that inability to sit still, you might attribute that to something else other than mobility. But really, if we then end up putting our resources in the wrong kind of bucket in that case, and that student struggles longer than if we can identify it early and figure that out.
Exactly.
So many of our listeners have encountered physical therapists in clinical settings where therapy is really hands-on, very direct. In schools, though, physical therapists frequently work indirectly by educating the adults who interact with the student on a daily basis, like teachers or case managers, sometimes paraprofessionals. How can teachers collaborate with physical therapists to support student mobility and independence in the classroom?
Yeah. We work with teachers and paras and school staff on motor programming or prompting or strategies to help that student across multiple environments and routines throughout their school day. The more they practice across a variety of routines, the more proficient they're going to get at that skill. So it doesn't make a lot of sense for us to come in weekly and practice that skill with the student for 15 minutes when they could be practicing that skill with all of their caregivers, all school staff across routines and they get that practice. Just like you're not going to run a marathon without doing some training. So you're not going to learn that skill without practicing. And practicing frequently and often is what research shows has the best results.
And would it be fair to say that, like in more of those clinical settings, that direct service is really teaching the individual to do it so that they go and they practice it that often on their own, whereas in the school, we want to give them multiple situations, and so we need to kind of teach multiple people to be prompting that as opposed to just doing these specific exercises.
Exactly. And it's usually training the movement through functional routines too. It's not carving out 15 minutes a day to do specific prescribed exercises. It's always, we try to always do something that's more functional, working on their morning routine every day, and these are the steps that we want you to follow, and this is how we want it to look. Or walking through the lunch line, and this is how we want the child to try to work on holding their tray and getting into their seat or getting up and down from the floor. Working with a young lady that has a physical impairment similar to cerebral palsy, and just working with the staff on simply, how does she get out of her chair to the floor? How does she get out of her walker to the floor? How does she get from her walker to the toilet versus her chair to the toilet? It looks different for this student, and we have to work through all of that. So we work together, we develop a plan, they practice it, and then if there's improvement, then we can tweak it and move forward. So we're just slowly moving towards that.
I can definitely see huge advantages for that. I had physical therapy, and I kind of wish somebody had followed me around a little bit and said, this is what you're going to need to be able to do, because sometimes it's a little bit more motivating, I think, when you know I'm doing this for an actual reason rather than just, these are just exercises that will hopefully help me with other functions. But to be able to see that in practice and stuff has to be helpful for students too.
Yeah, and movement enhances brain development. And it also, as you practice, that child is learning competence, but they're also increasing their self-confidence. Yeah. So I think that's the most rewarding part about the job, is watching these kids learn that confidence and that independence, or moving towards independence. And there's just a natural movement towards increased participation, increased peer and social interactions, because they have that confidence and they want to try new things, and they want to be with their peers, and it's really fun to watch.
And that independence has to make school more fun for them, right? I mean,
absolutely.
Where they've been limited in some other situations, being able to come into school and see, hey, I can do this with my friends now. It's got to feel really good for them too.
Yeah, it's great.
Well, thank you, Tessa, for providing us that valuable insight into the role of physical therapy in school. It's been a great discussion. Thank you so much. And I know our listeners will come to better understand how physical therapy helps students both physically and academically. So thank you again for joining us.
Yeah, it was my pleasure. Thank you.
That wraps up this episode of Conversations with Co-op. Join us again for more insightful discussions on important topics in special education. Until next time.